Imagine waking up tomorrow morning, swinging your legs over the side of the bed, and feeling nothing but strength, stability, and energy flowing through them. No more wincing from sudden cramps, no more feeling that shaky weakness when you stand, and no more quiet fear of losing your balance. Just the confident knowledge that your legs will carry you through the day, whether that means strolling in the park, dancing to your favorite song, or simply moving around your home with ease. If you want to stay active, independent, and fearless as the years go by, here's the truth. The secret doesn't lie in expensive gadgets or endless workouts. It lies in what you feed your body. And today, I'm revealing the 7 most powerful vitamins and minerals that can keep your legs strong, steady, and quite frankly, unstoppable. From boosting muscle performance, to protecting bone density, to improving blood circulation, these nutrients aren't just good to have, they're game changers for your mobility and long-term independence. The difference they can make in how you move, stand, and feel every single day is extraordinary. So whether you love peaceful morning walks, energetic dance classes, weekend hikes, or simply the independence of moving without help, this is the video for you. Before we dive in, I want to know, where in the world are you watching from today? Drop a quick comment below, and don't be shy about asking questions. I read them all. And if you haven't already, tap that subscribe button and hit the notification bell so you never miss a single tip from health. Together, we're building a stronger, healthier future, one step at a time. Now, let's start with the nutrient that stands at the very top of the list, vitamin D. As we age, our bodies go through inevitable changes. Muscle mass decreases, bones lose density, and movements that once felt effortless can become slow and challenging. But here's what many people don't realize. One of the biggest culprits behind this decline is a hidden deficiency in vitamin D. It's not just about brittle bones. Vitamin D is a foundational nutrient for keeping your legs strong, your balance steady, and your movements coordinated. Without it, your legs slowly lose their power, and you might not even notice until it's too late. Why is vitamin D so important? Let's break it down. Our skin naturally produces vitamin D when exposed to sunlight. But as we get older, our skin becomes less efficient at this process. On top of that, many seniors spend less time outdoors, whether because of mobility challenges, health concerns, or simply avoiding too much sun exposure. The result? A widespread deficiency that silently erodes muscle strength, leaving legs weak, unsteady, and more prone to falls. In fact, scientific studies consistently show that low vitamin D levels are directly linked to muscle weakness and a higher risk of falls among older adults. One major study in the Journal of Clinical Endocrinology and Metabolism found that seniors with healthy vitamin D levels had stronger muscle fibers, better coordination, and improved balance dramatically, reducing their risk of injury. On the other hand, a deficiency doesn't just slow you down, it accelerates muscle loss. Everyday tasks like climbing stairs, standing from a chair, or walking for more than a few minutes can suddenly feel like uphill battles. But vitamin D's benefits go beyond just bone health and calcium absorption. It directly influences muscle function by enhancing protein synthesis and improving the way your brain communicates with your muscles. Think of it as the electrical wiring that allows your muscles to respond quickly and powerfully. This is especially important for your fast-twitch muscle fibers, the ones responsible for quick reactions and balance recovery. Without adequate vitamin D, these fibers weaken, reaction time slow, and even a minor trip can turn into a dangerous fall. And there's more. Vitamin D helps reduce inflammation in muscle tissue. That means less chronic pain, fewer cramps, and more comfortable movement. If you've been dealing with unexplained stiffness, soreness, or nighttime leg cramps, optimizing your vitamin D might be the missing piece. Ignoring a deficiency doesn't just risk weaker legs, it opens the door to osteoporosis and serious fractures. Without enough vitamin D, your body can't properly absorb calcium, leaving bones brittle and vulnerable. A simple stumble could lead to months of recovery and loss of independence. Beyond your muscles and bones, low vitamin D has been linked to higher risks of heart disease, memory decline, and a weakened immune system. This one nutrient influences far more than most people realize. The good news? Boosting your vitamin D is easier than you might think, and the benefits are life-changing. Here are the most effective ways to get your levels where they need to be. Sunlight exposure. Just 15-30 minutes in the sun, ideally in the morning or late afternoon, can give your body a natural boost. Expose your arms and legs for maximum effect, but remember, sunscreen blocks vitamin D production, so plan your time wisely. Vitamin D-rich foods. Fatty fish like salmon and mackerel, fortified dairy, and egg yolks are excellent sources. While diet alone may not be enough for everyone, it's an important part of your daily intake. In the last section, we explored just how essential vitamin D is for keeping your legs strong and steady. But here's the thing. Vitamin D doesn't work alone. To truly protect your mobility and keep your muscles performing at their best, it needs to work in harmony with other vital nutrients. One of the easiest ways to boost your vitamin D levels naturally is by including the right foods in your daily meals. Fatty fish like salmon, mackerel, and sardines are excellent choices, as well as fortified dairy products, egg yolks, and even mushrooms. These can all contribute to your overall intake. For many seniors, especially those who spend little time outdoors, diet alone may not be enough. That's where vitamin D supplements come in. Most health experts recommend 800 to 1,000 IU per day for optimal bone and muscle health, though those with severe deficiencies might require higher doses, always under the guidance of a healthcare professional. If you're not sure where your levels stand, a simple blood test can give you a clear answer. Many doctors now routinely check vitamin D status in older adults because of its critical role in preventing falls and fractures. Now let's talk about calcium, the partner nutrient that works hand in hand with vitamin D. Unlike younger individuals whose bones are still actively rebuilding, seniors naturally experience a gradual loss of bone mass. This makes them more vulnerable to fractures, especially in the legs. Hip fractures, femur breaks, and stress fractures in the lower limbs are among the most serious injuries for older adults. A simple fall that might have been harmless in youth can lead to months of recovery or even permanent loss of mobility if bones lack the calcium reserves they need. But calcium's importance doesn't stop at bone health. It's also crucial for muscle contraction. Every single movement, from taking a step to rising from a chair, relies on calcium ions triggering muscle fibers to contract and relax in a smooth, controlled manner. Without enough calcium, muscles may cramp, feel weak, or fail to generate the strength needed to maintain balance and stability. This is why many people with calcium deficiency experience frequent leg cramps, slower movements, and reduced muscle endurance. So, how can you make sure your body is getting enough calcium? While dairy products such as milk, yogurt, and cheese are some of the richest sources, they're far from the only ones. Leafy greens like kale and bok choy, almonds, tofu, sardines, and fortified plant-based milks all offer excellent calcium content. The key is variety, combining different calcium sources throughout the day to ensure steady absorption and better bone maintenance. However, for some people, especially those with dietary restrictions or absorption issues, getting enough calcium from food alone can be difficult. In these cases, calcium supplements can be a valuable tool. particularly when taken alongside vitamin D, which improves calcium absorption in the body. But remember, more isn't always better. Excess calcium, especially from supplements, can lead to problems such as calcium deposits in the arteries, kidney stones, and digestive discomfort. Striking the right balance is essential. For older adults, the recommended daily intake is generally 1,000 to 1,200 milligrams of calcium, ideally from a combination of natural foods and supplements if needed. Beyond just consuming calcium, how you live matters too. Weight-bearing exercises like walking, resistance training, or even light jogging help stimulate bone remodeling, directing calcium into the bones and muscles where it's needed most. Without movement, even the best calcium intake can't fully strengthen your skeletal system. Neglecting calcium means risking more than just brittle bones. It can rob you of the freedom to move with ease, to enjoy the activities you love, and to maintain your independence. Next on our list is vitamin B12. While conversations about leg strength often focus on calcium and protein, vitamin B12 is just as vital for maintaining mobility because it's essential for healthy nerve function. B12 ensures that the electrical impulses traveling from your spinal cord to your legs remain strong, accurate, and timely. Without it, your muscles don't receive the proper signals, leading to weakness, instability, and a slow, creeping loss of control over movement. It's no surprise that one of the most common signs of B12 deficiency is a sensation of heavy, tired legs, often paired with numbness or tingling. And here's the concerning part. Vitamin B12 deficiency is shockingly common among older adults. Unlike some vitamins that can be stored in body fat or absorbed easily at any age, B12 absorption becomes less efficient over time. After learning about calcium and vitamin B12, we continue with an equally important topic: how your body absorbs B12 and magnesium's hidden role in mobility. Vitamin B12 absorption is highly dependent on digestive health. Your body needs sufficient stomach acid and a special protein called intrinsic factor to extract B12 from food. But as we age, stomach acid production decreases. Conditions like gastritis, acid reflux, or the long-term use of antacids can further interfere with absorption. On top of that, many seniors unknowingly eat diets low in B12-rich foods. The result? A slow, steady depletion of this essential nutrient. The consequences of B12 deficiency go far beyond feeling weak. If left untreated, it can cause irreversible nerve damage, affecting balance, coordination, and reflexes. Many older adults who struggle with frequent falls, difficulty walking, or that unsettling feeling that their legs just don't work like they used to, are actually experiencing the neurological effects of B12 deficiency. Sadly, the decline is often so gradual that it's mistaken for normal aging when, in reality, it is entirely preventable. The good news is that restoring B12 levels can dramatically improve mobility and energy. Research shows that seniors who address their deficiency often notice significant gains in strength, endurance, and leg function. But where does B12 come from? Unlike many nutrients that can be obtained from plants, vitamin B12 is found almost exclusively in animal-based foods. Lean meats, fish, eggs, dairy, and shellfish, especially clams and liver, which are among the richest sources. For those following a plant-based diet or who have absorption issues, fortified foods like breakfast cereals or plant-based milk, along with B12 supplements, become essential. Vitamin B12 is also one of the safest vitamins to supplement, as excess amounts are flushed out in urine. Many older adults benefit from higher-dose B12 supplements or periodic injections, especially if they struggle to absorb it from food alone. Regular blood tests are the best way to ensure optimal levels and prevent the gradual loss of leg strength. Here's the key takeaway. Strong legs are not only about muscle, they depend on your nervous system's ability to send quick, accurate signals. No matter how much you exercise, if your nerves aren't firing properly, your legs won't respond the way they should. Maintaining adequate B12 is one of the most overlooked yet powerful strategies for protecting your mobility and independence. Now let's talk about magnesium, the silent conductor in your body's movement orchestra. Every time you take a step, magnesium ensures that your muscles receive the correct signals to contract and relax smoothly. It prevents spasms, reduces fatigue, and supports endurance. A common but often ignored sign of magnesium deficiency is restless leg syndrome or frequent nighttime cramps. Many seniors are jolted awake by sudden painful muscle contractions that disrupt their sleep and recovery. This isn't just uncomfortable, it's a warning that your body is struggling to regulate muscle relaxation. Magnesium also plays a key role in bone density and joint health. While calcium gets most of the attention, it can't do its job without magnesium. This mineral helps direct calcium into bones where it's needed, instead of letting it build up in soft tissues, which can cause stiffness and joint pain. Studies have found that seniors with higher magnesium intake tend to have stronger bones and a lower risk of fractures. The problem? Magnesium is easily depleted by stress, certain medications, and poor diets. Many older adults take medications like diuretics, proton pump inhibitors, or some blood pressure drugs that lower magnesium levels. Combined with diets lacking in magnesium-rich foods, this leads to widespread deficiency that quietly erodes strength, stamina, and flexibility. This is why so many seniors notice themselves walking shorter distances, climbing stairs more slowly, or feeling tired after even light activity. Often, it's not simply old age. It's the lack of key nutrients. Replenishing magnesium can quickly improve leg function, reduce cramps, and boost overall mobility. After learning about the importance of magnesium for muscle and bone health, let's now take a closer look at how to get enough of this vital nutrient to maintain flexibility, strength, and energy in your legs. Magnesium doesn't just help reduce cramps and improve energy, it restores a sense of lightness and ease in every movement. Some of the richest food sources of magnesium include dark leafy greens, nuts, seeds, whole grains, and legumes. Foods like pumpkin seeds, almonds, spinach, black beans, and avocados are especially high in magnesium, providing a natural way to support healthy muscles and bones. However, if your daily diet falls short, magnesium supplements can be an effective solution. Among them, magnesium citrate and magnesium glycinate are often recommended because they're more easily absorbed by the body. When magnesium levels are restored, the transformation can be remarkable. Seniors who once felt their legs heavy and sluggish often find they can move with newfound lightness and energy. Those who struggled with frequent cramps or stiffness notice significant relief, helping them sleep better and walk more comfortably. Even balance and coordination can improve, as magnesium plays a key role in regulating the neuromuscular connections that keep your steps steady. Next, let's talk about potassium, a mineral that acts like a conductor for muscle activity. Picture this: you wake up in the morning, step out of bed, and instantly feel a sharp cramp in your calf. Sound familiar? This is one of the most common signs of low potassium. Potassium helps regulate muscle function by balancing fluid levels inside and outside muscle cells. When potassium is too low, muscles may contract involuntarily, leading to painful cramps, especially in the legs. For older adults who may already have reduced circulation or muscle mass, this can be more than just uncomfortable. It can limit mobility. But cramps are only the beginning. Potassium also ensures smooth communication between your nerves and muscles. When levels are low, This conversation between your brain and your leg muscles becomes less efficient, leading to shakiness, weakness, or difficulty lifting your feet properly, all of which significantly increase the risk of falls. And let's face it, avoiding falls is one of the most important goals for seniors. Potassium also plays a surprising role in bone health. It helps neutralize acids in the body that can gradually erode bone density. Studies show that a potassium-rich diet can slow down bone loss, reducing the risk of osteoporosis and keeping your leg bones strong. So, how can you get enough potassium? Nature has provided plenty of delicious options. While bananas might be the first food that comes to mind, they're just the beginning. Sweet potatoes, avocados, spinach, beans, and oranges are all excellent sources. Even a baked potato with the skin contains more potassium than a banana. The key is to include a variety of these foods daily, so your muscles and bones receive steady nourishment. For those who struggle to get enough potassium from food alone, supplements may seem like an easy fix. The recommended daily intake for adults is about 2,600 mg for women and 3,400 mg for men, a level that's usually achievable through a balanced diet rich in fruits, vegetables, and legumes. However, anyone with kidney disease, high blood pressure, or other conditions affecting potassium should consult their doctor to determine a safe and appropriate amount. Finally, let's move to vitamin K, a nutrient often overlooked when it comes to bone and joint health. If calcium and vitamin D are the stars of bone health, vitamin K is the traffic controller, ensuring that calcium is delivered to the bones where it belongs, rather than building up in arteries or soft tissues, which can lead to stiffness, poor circulation, and even heart disease. For older adults, vitamin K becomes even more crucial. Studies show that people with higher vitamin K intake have denser bones, a lower risk of fractures, and better overall bone health compared to those with low levels. That's because vitamin K activates osteocalcin, a protein that binds calcium to the bone matrix, making bones stronger and more resistant to breaking. And vitamin K's benefits don't end there. It's also essential for joint health and muscle function. Many people forget that healthy legs require not only strong bones, but also flexible joints and well-functioning muscles to keep them moving with ease. To continue from the previous section, we've seen how vitamin K contributes not only to strong bones, but also to smooth, pain-free movement. Vitamin K plays a vital role in keeping your joints healthy and your muscles functioning well. Research shows it can reduce inflammation in the joints, slowing the progression of osteoarthritis and easing stiffness, particularly in the knees, a common concern for older adults. If your knees ache when you move or feel stiff after sitting for long periods, vitamin K could be the missing nutrient that helps you move with greater comfort and freedom. Balance issues, difficulty walking, and a higher risk of falls are often tied to weakened leg muscles. Recent studies suggest that vitamin K supports muscle strength and coordination, especially in aging adults, by regulating calcium levels within muscle cells. This ensures proper contractions and prevents the uncoordinated movements that can cause instability. Some of the richest sources of vitamin K one commonly found in plants include spinach, kale, Swiss chard, collard greens, and Brussels sprouts. Another highly beneficial form, vitamin K2, is present in fermented foods like natto, fermented soybeans, aged cheeses, and certain animal products, such as egg yolks and liver. K2 remains active in the body longer and plays an even greater role in directing calcium into bones instead of arteries. To naturally boost your vitamin K levels, increase your intake of green vegetables and fermented foods. Even small changes like adding a daily serving of kale to your smoothie or having sautéed spinach with dinner can make a noticeable difference. For those who struggle to absorb vitamin K from food, especially people with digestive disorders or those on long-term antibiotics, supplements may help. However, if you're on blood-thinning medications such as warfarin, consult a healthcare professional before increasing vitamin K intake, as it affects blood clotting and may interact with these drugs. Vitamin B6, pyridoxine. Vitamin B6 plays a much greater role in leg strength and muscle function than many realize. While numerous nutrients contribute to mobility, B6 is essential for nerve health, muscle repair, and ensuring your body can use protein effectively to build and maintain muscle mass. Without it, even strong muscles can weaken over time, making simple actions like standing up from a chair or climbing stairs feel surprisingly difficult. One often overlooked aspect of vitamin B6 is its importance in nerve signaling and coordination. Low B6 levels can slow or disrupt these signals, causing numbness, tingling, and unsteady walking patterns. Many older adults mistake these symptoms for age-related muscle loss, when in fact a lack of B6 may be the cause. B6 also helps regulate inflammation, reducing muscle fatigue and keeping legs flexible and resilient. If you've noticed persistent stiffness or slower recovery after activity, improving your B6 intake could make a big difference. Beyond muscles, B6 is crucial for red blood cell production, which delivers oxygen to your muscles for sustained energy. A deficiency can lead to low hemoglobin levels, leaving your muscles underoxygenated and prone to early fatigue, heaviness, and reduced stamina. Excellent food sources of vitamin B6 include poultry, fish such as salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. Including these foods in your daily diet can naturally restore healthy B6 levels, supporting both nerve and muscle health. For people with digestive issues, poor nutrient absorption, or dietary restrictions, supplementation may be necessary. Older adults typically require about 1.5 mg per day for women and 1.7 mg per day for men. While it's generally safe to get B6 from food, high-dose supplements should be used cautiously, as long-term overuse can lead to nerve damage. The safest approach is a balanced diet rich in B6 foods, ensuring a steady supply without unnecessary risks. If you found this video helpful, please click the like button. It really supports our work in bringing you valuable health content. Share your thoughts or questions in the comments, and let us know what topics you'd like us to cover next. And of course, don't forget to subscribe and turn on notifications so you never miss our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.